Hi, Dr. Joel.
Hi Asha, thanks for having me over.
Thank you also. It's nice to see you outside the clinic
Yeah, I know.
for a change. So, I would like to introduce this to our viewers today about regenerative medicine. Would you like to tell us more about your journey?
Yeah, well, I started as a regular doctor. I trained in internal medicine in Chicago. During that time, I became disillusioned because it was about just treating symptoms with medications. So after my residency program, I eventually trained with alternative or holistic doctors all over the states. So it took me from Chicago to Florida and Alabama, and finally, during my last 10 years in the States, I was in San Francisco in California. Then I moved to the Philippines in 2012.
What made you go back to the Philippines, Doc?
Very good question. A lot of people actually ask me about that. Actually, I was attending my brother's wedding. It was a beach wedding in Boracay at that time. That
okay.
was 2010. So I fell in love with the Philippines again. So every quarter I would go home, and finally I got tired of doing that. So I decided to stay here full time.
You had to choose between the two
Yeah.
polarities that you have.
Yeah, exactly.
Okay.
But I actually still have a practice in the States.
So you have like your own clinic there with a partner, and you
Mhm.
also focus on holistic and regenerative medicine.
Yes,
right?
we do.
I know also, Doc, is you've brought a lot of like new styles of medicine here in the
Mhm.
Philippines. So would you like to tell our viewers more about
Sure.
this?
So basically, in my practice, we do, of course, anti-aging and regenerative medicine. So it begins with nutrition because that's really the basic for everything. So aside from nutrition, we do bioidentical hormones. So hormones which are similar to what our body produces. They're not synthetic, that's made in the lab, but this one is similar to what our body produces. So aside from that, we also do peptide therapy. We also do, like, of course, cell therapies, including mitoorganelles, stem cells, PRP, and so on and so forth. But it's about holistic approach in rejuvenating the body.
I think that's something that we usually forget, that we do take care of our cars, we do
Yeah.
take care of our houses. Even if we have the means, we forget to take care of our bodies. So how do you motivate your patients, Doc, when it comes to this mentality?
Yeah, good question. Yeah, it's really important to lead by example because I could say everything, but let's say if I'm not fit, then my clients won't believe me.
Yes.
So I make it a priority to exercise on a regular basis. I choose what I eat. It's harder to get organic food though here in the Philippines. It's harder to access it. So my advice to my clients is to try to grow their own food if possible. Yeah, that way it's to be free from, let's say, antibiotics or pesticides or things like that.
I think that's like one of the reasons whenever we go to the provinces and we eat farm food and even like dairy food from the
Yeah.
farm, you feel stronger.
Yeah, exactly.
And there's like this less anxiety, depressive emotions.
Yeah.
How would you correlate nutrition and mental disorders?
Yeah. So basically, we have neurotransmitters in the brains. So these are basically brain chemicals. So everything in our body comes from the food that we eat. So if you feed yourself with, we call it crap, which stands for conventional, refined, or artificial produce. So if you feed your body crap, you're gonna feel like crap, or you're gonna
Okay,
look like
very
crap.
simple.
Yeah, exactly. But if you feed yourself with like whole foods, then you'll feel better. You'll be able to feel better, look better, and just perform better in anything.
I think that's quite important nowadays. We have a lot of fast foods, we have energy drinks, and sometimes we forget when we're trying to do so many things at
Yeah.
once.
Yeah. Have you noticed like there are a lot of fast foods and there are a lot of pharmacies as well? So where the food that we feed ourselves is actually contributing to a lot of the illnesses that we see nowadays.
I agree, Doc. Like, I do remember that if I eat a burger, because I'm not feeling well, I would feel worse afterwards. Whereas if I eat a bowl of blueberries, afterwards I'd feel calmer.
Yeah.
And before I did not understand this, but I read this book, Your Brain on Food, and turns out whatever we eat, especially if we have mental problems or like challenges, you could say
Yeah.
like you're having depression, anxiety, or stress, it's actually linked that depending on the kind of stress that you have, if you're depressive or you're anxious, there are foods to avoid, and there are actually foods that you could eat more to make you feel better on that mental problem that you
Yeah.
have.
Yeah. It's really important to think about what we put in our mouth. So think about how it would affect you, like physically or mentally. Because you could actually divide things into like pro-inflammatory or anti-inflammatory foods.
Tell me about this, doc. This
Yeah.
pro and
Yeah.
anti-inflammatory foods.
Yeah, so usually the pro-inflammatory foods are meats in general, especially if they are deep fried.
Okay.
Yeah, but so it's just an easy
I'm
thing
guilty
to
now,
think about.
doc. My French fries are shaking.
Then anti-inflammatory foods in general are like fruits and vegetables.
Okay, I'll keep that in mind.
Yeah.
Thank you, doc. So, like, okay, this is pro,
Yeah.
this is anti, according to doc. You also mentioned earlier about stem cell, and if you're reading more on like pro athletes around the world, they're already talking about stem cell regenerative therapy,
Yeah.
PRP. So,
Yeah.
how about for normal people such as myself or other working like office people? How will this benefit them?
Yeah, so stem cells help the body regenerate. So it's not only good for people who have certain illnesses, but for those who want to do more of a preventive path,
Yes.
they could actually do things to keep their stem cells healthy. But as we age, of course, the number of our stem cells begin to decline. So there are things like, for instance, the hyperbaric oxygen therapy,
Yes.
which actually stimulates the release of stem cells from our bone marrow. So
Amazing.
yeah, this is something that actually a lot of athletes do this. I guess a lot of actors do this as well.
Because they need to, look young,
Yeah.
have a physical strength of a younger being than they have. So that's interesting.
Yeah.
How about for people who are working so much in the office and they're having lower back pains? So what would you recommend to them?
Yeah, so it's really important to do a whole body exercise because sometimes when we go to the gym, it's just like forward or backward movements or sideways. You gotta move your whole body. That's why there are places like in the States, dance movement therapy. Not sure though if there are places like that one here yet. But there are gyms that actually focus on whole body movement or functional training. So it's important to move, and when you're stressed out, do things that are constructive, like exercise, for instance, or meditate, or get a massage, rather than eat, which is other people do when they are stressed out.
I think that's like also a mentality where how we could manage our stress. So apart from eating, there's meditation, good food, massage,
Yeah.
exercise.
Deep breathing exercises.
It's amazing.
Yeah, so many things someone could do to help relieve stress.
How about you, Doc? What do you do to relieve stress?
I watch watch movies. Well, kidding aside, I do exercise. I do Pilates. I do weight training. Not that much into running because it's too stressful on the
For the
joints.
knees, yeah.
Yeah.
I also noticed that when it comes to workout, there's not one sport fits all.
Yeah.
So depends on the body type, like their drive to sweat. What is it? So I'd rather play basketball than do horseback riding.
Yeah.
So it really depends.
Yeah, yeah. Good thing you brought that up, Asha, because now there are genomic or DNA testing that a person could avail of, and it'll tell you what is your perfect diet or the perfect exercise that you could participate in.
Amazing.
Yeah.
I do not know this, Doc.
Yeah, it's available.
Where can I find this, Doc? I want to do this.
It'll be available soon in the Philippines.
Okay.
Yeah.
Will it be
Yeah.
one of those projects that you'll be bringing in, Doc?
Yeah.
Amazing.
Definitely.
Okay, you have to keep me updated.
Yeah,
on
will
this.
do.
Another thing that you mentioned earlier is PRP.
Yeah.
So and the peptide shots, would you mind explaining more to us how it works, Doc?
Yeah, so PRP has been around for a while, and mostly orthopedic doctors were the ones who initially started using it. But it's now being used by aesthetic doctors as well, like to rejuvenate the skin as well as the hair. It's about getting like plasma,
Okay.
and then spinning the whole blood and getting the portion of the blood called a plasma, which is rich in platelets.
Okay.
Yeah, so these platelets, they have a lot of growth factors, which would help rejuvenate like the joints, skin, or hair.
I see. So usually for women also this would work if they're injured. Women are more injured actually.
Yeah, both men and women. And there are PRP shots actually that could be done in men who have, let's say, ED or erectile dysfunction. It's called the P shot. And for women who are having problems with like orgasm,
Okay.
Yeah, it's called the O shot.
This is interesting.
Yeah, it was actually discovered and widely recommended by a doctor from the States, Dr. Runels. Yeah.
Okay, so how does it work? Like in a span of like 3 months, if you take this shot, you won't have problem, or is it like one shot problem free for the rest of your life?
Sometimes a shot or two should be sufficient, but of course, I will always recommend a holistic approach. Yeah, if you want to lessen the inflammation in the body, you gotta eat more anti-inflammatory food.
So that's just a factor that helps specifically, but you still need to take care of your overall body.
Yeah, exactly.
It's amazing. I wonder if the shots for the sexuality of beings are already here in the Philippines.
I think there's someone who's doing it,
Yeah.
but this is something that we'll offer in our clinic once we open.
You actually, Doc, offer the testosterone therapy
Yeah.
and the female hormone therapy already.
Yeah.
So in Doc's clinic, he has a lot of therapies, from including when you have injuries or when you want to fix your platelets, right? And also the hormone therapy. So Doc,
Yeah.
would you tell us more about the hormone therapies?
Yeah, so as we age, our hormones begin to decline, and that could lead to a lot of symptoms. People think that hormonal imbalance only happens in like the 30s or 40s, but we're actually seeing it in younger people nowadays. And this is because like our food sometimes has hormones, or let's say drinking from plastic containers that could leach chemicals that act like hormones in our bodies. They're called xenoestrogens. And that's why we're seeing, let's say, PMS in younger women. We see PCOS nowadays in more women. Even the symptoms such as low sex drive in men, even hair loss, that could also happen in younger men nowadays, all because of hormonal imbalance. So once you balance the hormones, then a lot of these signs and symptoms could improve.
I agree. Like, even if you're not at the age where you're supposed to lose your testosterone, I heard that stress is a factor. It
Yeah,
makes you
it
stop
does.
generate your testosterone.
Yeah,
Right?
there's something called cortisol steal.
Yes.
Yeah, so if a person has a lot of stress, they would make more of the hormone cortisol.
The
And when
stress
they
hormone.
yeah, exactly. And when that happens, that'll compromise the production of sex hormones, like testosterone in men and estrogen and progesterone in women. Yeah.
So for women also, the lack of hormones for our estrogen is also based on stress.
Yeah.
And what happens to women when they have this?
When they have this cortisol still, well, it usually would lead to, because the adrenals would actually also affect the thyroid. They actually, what we call yin-yang organs.
Yes.
They work together. So if the adrenals are off, then the thyroid is off too. So a person who has a lot of stress with too much cortisol, that could interfere with the conversion of the inactive form of thyroid to the active form of thyroid. So sometimes that could lead to weight gain. Yeah, when a person's under a lot of stress.
I think that also happens to me, Doc. Like, I wouldn't eat, but since I'm stressed, I could feel that I'm having weight gain.
Yeah.
So,
yeah.
so this is the cortisol steal then.
Yeah.
Okay, noted. Okay, and if you're going to bring in something that's for preventive healthcare in the Philippines, what would be your priority and why?
Yeah, well, it all starts with basic nutrition, eating the right foods. Yeah, so if you have these building blocks for, let's say, the generation of muscles in our body, then we'll be able to function properly. There's a condition called sarcopenia, which is the loss of muscle mass as we age. So if you don't use it, you lose it. So it's really important to exercise properly, because when you do exercise, you actually secrete growth hormone too from your pituitary gland. So that's one of the easiest way to slow down the aging process is just by exercising.
I noticed this. And how about fasting? What can you say about fasting for both men and women?
Yeah, fasting is a great way to help improve your general body condition, especially, let's say, those who have food intolerances. Yeah, but it's also a good way to improve your metabolism and improve your body composition. Yeah, so sometimes it's not about the food that you eat, but the timing. So sometimes people eat more at night.
Yes, we
Yeah,
do.
yeah.
I do.
Yeah. And actually, that's the time when our metabolism slows down. So it's important to eat more during the day and less at night. And then, of course, intermittent fasting is very popular nowadays. So that's one great way to improve everything, not just your body composition, but also your blood chem.
Oh, I understand. There's something that happened to my mom, and we're wondering whether it's linked to this. So she's been doing intermittent fasting for almost 2 months now.
Yeah.
And according to her, her white hair disappeared.
Mm.
So is this linked? How does this work? We're confused.
Yeah, that's an interesting anecdote.
I told her she needs to go to a lab. She could be experimented on.
Yeah.
But could this be possibly linked? And she lost so much weight, but she didn't feel depressed. Unlike
okay.
if you do super diet. What do you think about this?
Yeah, I think it's just really about the timing of eating foods, because we're always told that you have to eat 3 meals a day. Yeah, but a lot of the energy spent by the body is spent on digesting or assimilating food, that there's not enough time for other physiologic processes. Like, for instance, our immune system, that has to work. But if if all the energy is spent on digesting or assimilating food, or just focusing on metabolizing food, then not enough energy is spent on, let's say, the immune system to guard the body against infections or tumors or repairing any damages in the body.
Tell me about your new clinic, upcoming clinic, Charm by Dr. J. Lopez.
Yeah. So CHARM stands for Center for Healthy Aging and Regenerative Medicine. So basically, that's what we want to focus on. And since everybody's aging, everybody's a candidate for treatments at our office. Of course, it begins with the basic, like I said, it always begins with the simple things like eating properly, drinking enough water, getting enough rest or sleep or exercise, just the basic. Yeah.
I think like for females and even males, I notice whenever they have a birthday,
Yeah.
they're a bit sad. And when no one's around already, or there's like, space to talk about it, I said, "What's bothering you?" And their answer is, "I don't want to be old."
Yeah.
And I said, there's a way to cure this.
Yeah,
Well,
yeah.
there's like so many technologies for this. Concern for women usually is to look old, whereas for the guys, they don't want to feel old. Like they still want to be strong.
Yeah.
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 So, how would you show this to these kinds of people? The ones where they think like, this is it. I'm getting old. I have nothing to do. I cannot do anything about this. So
Yeah.
how will you introduce Charm to them?
Yeah. Yeah, so it's about a change in mindset.
Yes.
Yeah, because people think that, or equate being old to, like, let's say, being in the nursing home, especially in the States.
Yes.
But it doesn't have to be that way. People could grow older chronologically, but biologically still stay young. Yeah, there are different populations around the world called blue zones. These are places in which people live into their hundreds, but they're
Wow.
still productive. Yeah, like for instance, the Sardinians in Italy. There's this group in Loma Linda in California. There's Okinawans.
In Japan.
Yeah, in Japan.
Yes.
So they live until their hundreds, but still healthy. Yeah,
Yes.
but there's a lot of factors that could contribute to that. Like, for instance, eating only until you're 80% full. You don't want to eat too much. Yeah. And then there's also the use of wine among the Sardinians because of the something called resveratrol. Yeah, so it's a nutrient that helps with the telomeres. Yeah, so it helps keep people young. But of course, in moderation.
Too much. What will happen if it becomes too much, doc?
Yeah, well, it's alcohol. So yeah, so moderation in everything.
So speaking of this, substance abuse, smoke cessation, right? So how do you deal with this when it comes to your patients who wants to live a more holistic, healthier life?
Yeah.
What are the things that you could do for this?
Yeah. So there are different things that a person could try, like for instance, acupuncture for those who have addiction to nicotine.
Yes.
Yeah. There are nicotine patches, but I don't know how effective that would be. But of course, holistic approach is what we do recommend. But for substance abuse in general, there's something that we use in the States called NAD, but it's available here now. This NAD is derivative of vitamin B3. It basically balances the brain chemicals. So it's being used there in like a lot of rehab facilities, but you have to do this intravenous NAD like for 10 days in a row, ideally.
To cleanse off your system.
Yeah, and to balance the brain chemicals. Yeah, so some rehab clinics use like daily infusions of amino acids, again, to balance the brain chemicals. This like for 10 days. And success rate is really high compared to taking just certain medications.
Amazing. So I think like when it comes to substance abuse, they just like if they don't have a medical counterpart or a holistic ally, it's really difficult.
Yeah, it is.
So if people would like to reach Charm for these products and
Yeah.
services that you just mentioned to us, how will they reach you, Doc?
Yeah, you could check out our social media platforms at Dr. J. Lopez MD or Charm by J. Lopez MD. You could also check out our website at charmjlopezmd.com. Thank you so much.
Thank you so much, Dr.
Thank you,
Joel.
Asha.
You are the best.
Thank you, you too. Thank you.